Today we are going to talk about atopic dermatitis in dogs, a hereditary, usually lifelong inflammatory skin disease in which the immune system overreacts to environmental allergens such as house dust mites, pollens, and molds. It is not contagious, and a positive allergy blood test alone does not diagnose it. Most affected dogs first show signs between 6 months and 4 years of age. The disease begins with a defective epidermal barrier. Allergens penetrate the skin, activate keratinocytes and antigen-presenting cells, and trigger inflammatory cytokines. Interleukin-4 and interleukin-13 reinforce allergic inflammation and barrier dysfunction, while interleukin-31 activates sensory nerves and produces intense itching. Scratching, licking, and chewing then damage the barrier further, creating an itch-scratch cycle. Staphylococcal bacteria and Malassezia yeast commonly overgrow on this damaged skin and worsen flares. Itching often appears before obvious lesions. Dogs commonly chew the paws, rub the face, scratch the ears, and develop redness in the axillae, groin, ventral abdomen, and around the anus. Recurrent otitis externa may be the first or only sign. Chronic disease can produce alopecia, excoriations, papules, hyperpigmentation, thickened lichenified skin, greasy scale, odor, pustules, or epidermal collarettes from secondary infection. Diagnosis is by exclusion. A veterinarian performs flea combing, skin scrapings, skin cytology and ear cytology, treats parasites or infection, and then reassesses the remaining itch. A strict prescription hydrolyzed or novel protein elimination diet is usually continued for about 8 weeks, followed by re-challenge with the previous diet to rule food allergy in or out. Intradermal or serum allergy testing is performed only after the clinical diagnosis when allergens must be selected for immunotherapy. Treatment is multimodal. For a severe acute flare, prednisone or prednisolone may be used at about 0.5 to 1 mg per kilogram by mouth every 24 hours for several days, then tapered toward every 48 hours and stopped as control returns, commonly over 1 to 3 weeks. Glucocorticoids bind intracellular receptors and suppress inflammatory gene transcription, so they work quickly, but prolonged use can cause excessive thirst, urination and appetite, muscle loss, infection, diabetes and iatrogenic hyperadrenocorticism. Localized lesions may instead receive hydrocortisone acetonate 0.0584% spray once daily for roughly 7 to 14 days, reducing local inflammation with less systemic exposure. Oclacitinib, or Apoquel, is dosed at 0.4 to 0.6 mg per kilogram by mouth every 12 hours for no more than 14 days, then every 24 hours for maintenance in dogs at least 12 months old. It blocks JAK-dependent signaling from pruritigenic and inflammatory cytokines, including IL-31, so itch may improve within hours. Locavetmab, or Cytopoint, is a caninized monoclonal antibody given subcutaneously at a minimum of 2 mg per kilogram every 4 to 8 weeks. It binds and neutralizes IL-31, targeting itch without acting like a broad steroid. Cyclosporin, or Atopica, is useful for long-term control. It is started near 5 mg per kilogram by mouth once daily for about 30 days, ideally away from food, and then reduced to every other day or twice weekly if remission continues. It inhibits calcineurin, reducing T-cell activation and IL-2 transcription, but 4 to 6 weeks may be needed for full benefit, so it is not a rescue drug. Ilionocetinib, or Zenrelia, is another once-daily JAK inhibitor dosed at 0.6 to 0.8 mg per kilogram in dogs at least 12 months old. Dogs should be current on vaccines before starting it, and the label requires stopping it for at least 28 days to 3 months before vaccination and withholding it for at least 28 days afterward. Secondary pyoderma or Malassezia dermatitis should be treated only when examination and cytology support infection. Topical chlorhexidine, often combined with an azole antifungal, can reduce organisms and help prevent recurrence. Systemic antibiotics or antifungals are reserved for more extensive disease and continued until clinical and cytologic resolution rather than stopped simply because the skin looks better. Prevention means reducing flares, not curing the allergy. Consistent flea control, regular bathing with a moisturizing or antiseptic shampoo when indicated, washing bedding, reducing known exposures and treating ear or skin infection early all lower the allergic load. Allergen-specific immunotherapy, given by injection or under the tongue, gradually builds immune tolerance. Because improvement may take up to 12 months, the trial should continue for at least a year, and successful dogs often remain on it long-term while faster medication controls symptoms during the build-up period. Reach out to dogtoursgame@gmail.com if you have topics you'd like to suggest or donate to our game and video development.